Neurology Quiz number 8. What is pituitary apoplexy? This is a hemorrhagic infarction of the pituitary gland. It is usually associated with an underlying tumor, most commonly a macroadenoma. Risk factors include pregnancy, anticoagulation, head trauma. The likely mechanism is that the rapidly growing tumor outstrips its blood supply. Most common symptom is retroorbital headache, which can be thunderclap in onset. Optic chiasm compression can lead to visual disturbances, and cranial nerves 3, 4, and 6 are involved by extension into the cavernous sinuses. Meningeal irritation and alteration of sensorium, including coma, are other features. It can cause a neuroendocrine emergency due to acute adrenal insufficiency. MRI is the imaging of choice and demonstrates blood in the enlarged pituitary. Emergent treatment is required for acute adrenal insufficiency, and in the long term, patients will require replacement of other hormones due to hypopituitarism. Surgery may be required in cases with severe mass effect. The drug sodium oxybate is used for treating which condition? This is a derivative of gamma hydroxybutyrate. It is approved for treatment of excessive daytime sleepiness and cataplexy in patients with narcolepsy. It is available as a solution. Dose is 6 to 9 grams per day in 2 divided doses. Common side effects are headache, dizziness, decreased appetite, nausea, and parasomnias. Children can experience nocturnal enuresis. Serious side effects include altered sensorium, respiratory depression, suicidal ideation, and abuse potential. What is non-artertic anterior ischemic optic neuropathy, or NA-AION? AION refers to ischemia of the optic nerve head. The optic nerve is supplied by multiple short posterior ciliary arteries that arise from the central artery of the retina. AION is of the non-arteritic type, and the arteritic type secondary to giant cell arteritis. Non-arteritic AION comprises 85% of the cases. Mean age is 60 years. Risk factors include diabetes, hypertension, hyperlipidemia, obstructive sleep apnea, and use of phosphodiesterase 5 inhibitors such as sildenafil. A significant anatomic risk factor is a crowded nerve head with a small optic cup, which is also known as the disc at risk. It is characterized by loss of vision, which is sudden and painless, but can progress over a few days. Initially, hyperemic disc swelling is seen, followed later by optic atrophy. Altitudinal field defects are typical. 40% of patients show improvement in vision after a few months. 20 to 25% can develop AION in the other eye within 3 years. Recurrences in the same eye are rare. There is no effective treatment, although sometimes short courses of steroids are given. Control of vascular risk factors and use of antiplatelet agents is important to prevent involvement of the other eye. Differential diagnosis includes the arteritic type of AION, as well as central retinal artery and central retinal vein occlusion and optic neuritis.